for a long, long time, our main weapons against cancer have been, well, pretty blunt instruments. We're talking surgery, radiation, chemotherapy. But what if we could fight this disease on a totally different scale? A microscopic one. Today, we're going to dive into the world of nanotechnology, a truly groundbreaking frontier that's arming us with tiny tools to wage a much smarter, more targeted war on cancer. And you know, the stakes here could not be higher. That number you see, 9.7 million, that's how many deaths cancer is responsible for around the world every single year. That's not just a statistic. It's the urgent human reason we are so desperate for better, more effective treatments. So, here's how we're going to break it all down. First, we'll look at the problem with those blunt instrument treatments I mentioned. Then, we'll get into the nanotech revolution that offers a brand new solution. After that, we'll see the specific tiny tools making a huge impact. And finally, we'll look at the road ahead, getting this stuff from the lab into the real world. All right, let's start by digging into that first point, because you really have to understand the core problem that nanomedicine is trying so hard to solve. And it all boils down to one simple but massive issue: the lack of precision in our current cancer therapies. Think of conventional chemotherapy like this. It's basically carpet bombing your body. It's a powerful poison that's designed to kill any cell that divides rapidly. Now, that does include cancer cells, but it also includes the healthy cells in your hair, your stomach, your bone marrow. This huge collateral damage is what causes those awful side effects we all know about. And it's not just about feeling sick. This toxicity often limits the dose a patient can even handle, which can weaken the whole treatment. So it's clear we need a new approach. We need to go from carpet bombing to a GPS-guided missile that hits the tumor and only the tumor. And that GPS-guided missile? Well, that's exactly where nanotechnology comes into the picture. As we're about to see, this is the game-changing, precision-guided solution that doctors and patients have been waiting for. So what even is nanotechnology? We're talking about building things on a scale that is just mind-bogglingly small. A nanometer is 1/1000th of a meter. To give you some perspective, a single human hair is about 80,000 nanometers wide. By working with materials at this tiny, tiny scale, we can give them totally new and unique properties, which opens up a world of possibilities for medicine. And that really gets to the heart of it. The core promise of nanomedicine is simple but profound: deliver the right drug to the right place at the right time. It's all about building these smart little delivery vehicles that can carry powerful drugs through your bloodstream, sneak past healthy tissue, and then, bam, unleash their payload only when they've reached the tumor. This whole approach is designed to maximize the drug's punch while cutting down on that devastating collateral damage. Now, you might be wondering, how do these nanoparticles know where to go? Well, here's the wild part. Tumors actually help set their own trap. It's thanks to something called the EPR effect. You see, as tumors grow like crazy, they build this messy, leaky network of blood vessels, and at the same time, they don't drain fluid very well. This creates the perfect scenario for nanoparticles to slip through the cracks, get into the tumor, and then get stuck there. It's like a natural targeting system that helps the medicine build up right where we need it most. So, now that we kind of get the how, this clever trick tumors play on themselves, let's see what this actually looks like in practice. This is where we go from the cool science theory to a whole new toolkit that's already giving doctors new ways to fight cancer. And this new toolkit is pretty amazing. You can basically break it down into 4 key areas. First, smarter drug delivery, those smart bombs we talked about. Second, using these particles for earlier, more sensitive detection. Third, developing brand new weapons where the nanoparticles themselves destroy tumors. And fourth, a really critical one, using nanotech after surgery to stop the cancer from ever coming back. Let's start with that first one, because it's the most developed application right now. Using nanoparticles as these super sophisticated delivery trucks to get chemo drugs exactly where they need to go. And scientists have come up with a whole zoo of these nanocarriers. You've got liposomes, which are basically tiny bubbles of fat. There are polymeric nanoparticles, some of which can be made from stuff like chitosan, which comes from crab shells. How cool is that? And this isn't science fiction, by the way. The very first FDA-approved nanomedicine was a liposomal drug called Doxil, and it hit the market way back in 1995. Okay, let's talk about a huge and often heartbreaking challenge in cancer care. A surgeon can do a fantastic job removing a tumor, but often microscopic cancer cells get left behind. And those sneaky leftover cells are one of the main reasons a tumor can grow back right in the same spot. And this is where local drug delivery systems are a total game changer.
Instead of flooding the whole body with chemo, we can use nanotech to deliver a high, concentrated dose of drugs right into the spot where the tumor used to be. The mission? Hunt down and kill any of those leftover cells. And there are a few ways to do it. You can use an injectable gel for a quick hit, place a biodegradable implant that releases drugs slowly over weeks, or even use a spray to cover a large area. The goal is always the same: mop up the stragglers and slam the door on recurrence. So that's treatment. But nanotech is also shaking up the world of diagnostics. Because we all know, the earlier you can find cancer, the better your chances are of beating it. This brings us to one of the coolest ideas in all of nanomedicine: theranostics. It's a mashup of therapy and diagnostics. The idea is to build one single, multi-talented nanoparticle that does it all. It gets injected, it finds the tumor, it lights it up so doctors can see it on a scan, it delivers the treatment, and it lets doctors watch in real time to see if it's working. It is the ultimate see and treat approach, all packed into one tiny particle. All right, finally, let's look at how nanoparticles can stop being just the delivery truck and actually become the weapon itself, opening up totally new ways to attack tumors. Okay, this is where it gets really clever. Some nanoparticles, especially gold ones, have this amazing property. If you shine a special kind of light on them, they heat up a lot. It's called photothermal therapy. So doctors can inject these gold nanoparticles, let them pile up in the tumor thanks to that EPR effect, and then use a laser to basically cook the cancer cells from the inside out, all while leaving the healthy tissue around them perfectly fine. So the potential here is obviously just massive. But for our final section, we need to be realistic and look at the path forward. Because there are still some pretty big hurdles to clear before these incredible technologies can get from the lab to your local hospital. Yeah, bringing this to patients isn't easy. I mean, first, you have to be absolutely sure these particles are safe in the body for the long haul. Then there's the massive challenge of making them, going from a tiny batch in a lab to producing them on an industrial scale. And of course, regulators have to figure out how to even approve these complex new drugs. Plus, not all tumors are the same, which makes targeting tricky. Bridging that gap between the lab bench and the patient's bedside, that's the final frontier. But the future is incredibly bright. The real magic is going to happen when we start combining these technologies. Just imagine using AI and a patient's own genetic data to design a custom nanoparticle that's perfectly tailored to attack their unique cancer. We are really looking at the dawn of a new era of truly personalized medicine. Which leaves us with one last big question. We've gone from carpet bombing to guided missiles. As this technology keeps getting better and smarter, you have to wonder, will these tiny, intelligently designed tools become our biggest and most precise weapon in the fight against cancer?